My cancer journey began in March of 2025. I started having some symptoms that were more than just me thinking that my gallbladder was just acting up again. Dr. Gahagan, Dr. Tabor, they came in and they were, telling me that it was an adenocarcinoma. The way that team just came into my room, I just had this peace that they were going to take care of me.
So the typical treatment plan when the patient has pancreatic cancer involves first a multidisciplinary discussion between the surgeon and the medical oncologist about how to best treat that particular patient. The multidisciplinary approach to me means more than just a meeting before the patient initiates treatment. It's more than just a tumor board meeting. It's the ability, in Miss Marilyn's case, to pick up the phone, to call Dr. Gahagan in the middle of his clinic and discuss how she's doing 3/4 of the way through her chemo plan and make the decision that now it's time to go to surgery.
There are times where we may need to make changes to the IV chemotherapies that they're receiving to kind of give them the best chances of getting, the most complete treatment.
Dr. Tabor, he did an excellent job on my surgery. He said it only took 4.5 hours to do the Whipple.
The Whipple historically is looked at as a very difficult operation to recover from, historically is looked at as a technically challenging operation. And although we respect the technical challenging side of things, we have been able to do things now robotically that we couldn't do before, we couldn't do 10 years ago, and we're allowing for better patient outcomes because of it.
At that moment when I had that last chemo and I rang the bell, I knew it was because I was cancer-free. It was just now staying that way.
I think some of the things that kind of helped Miss Gentry along the way was, her positive attitude and positive outlook on life. She always liked to be moving and to be a busybody, and I do think that helps patients, better tolerate chemotherapy treatments when they are able to stay more active. Now, obviously, there can be some limitations with how active you want to be, and when that happens, we're there to try to help maybe changing the dosing of the chemotherapy, helping, IV fluids, which, she would routinely get throughout her treatment process to kind of give her a little bit of a boost to stay as active as she'd like to be, but then also having the family kind of support system around her that she did. You kind of build a close relationships with your patients, seeing them throughout that entire journey, whether it's through the chemotherapy treatments, getting them ready for surgery, and then seeing them in the hospital after they've undergone their surgery, just following them throughout the whole process. And it's an enjoyable part of, being an oncologist is not getting to just know the patient well, but also, family members as well.
They were always there when if I had a question or if I called. I just really can't say enough good things about the support that they give.